Good morning. Welcome to the August Provider Forum. My name is Chauncey Dameron, Provider Relations and Engagement Manager, and I will be leading you into our forum today. A few things I want to review with you all. We have our subject matter experts in the chat to answer your questions. So if you have a question at the end of the presentation, feel free to raise your hand and we'll call on you. We can unmute you and you can ask your question. We also have the Q&A within the chat bubble, so you can ask your questions there throughout the presentation if you have any, if they arise. If we have any questions that require any more research, then we will have them provided to you on a frequently asked questions document that we post on our website along with the presentation and the recording of the presentation. We have our accessibility features and our closed captions at the bottom, and the use of artificial intelligence featuring including but not limited to programs and or apps to assist with transcription or recording during any Trillium WebEx meeting is not permitted. This meeting includes the following features: recording and transcript. Next slide. The Q&A, go back one slide. The Q&A feature is located at the bottom of your screen in the right-hand corner. You'll be able to just type your question there and a subject matter expert will respond to you in the chat directly to your question. I'm going to go over the agenda that we have for today. First up, we have disaster preparedness, and then we have RFI, RFP, residential updates. Next, we have claim denials, then eligibility and enrollment. Then we have CCH presenting information to us as well. Then we have NC tracks and provider updates. And then we're going to cover the topic of our provider forum and information about our upcoming meetings. So I'm going to kick things off and give you a little bit about information about Trillium. Trillium Health Resources is a tailored plan and managed care organization that manages serious mental health, substance abuse, and traumatic brain injury and intellectual developmental disability services in North Carolina. For individuals receiving Medicaid throughout the tailored plan, we cover physical health care and pharmacy services as well. We also help uninsured individuals through state-funded services. Next slide. We cover 46 counties. Our land mass is 28,977 square miles, with a percentage of land mass being 59.61% in North Carolina. The total population is 3,152,058, and the percentage of North Carolina population makes up about 30%. Our network is made up of physical health providers, which totals 54,105. We have 14,103 behavioral health providers, 452 vision providers, 2,788 pharmacy and medical supply providers, and we cover the entire 100 counties of North Carolina. Now we're going to go over some of our tailored plan partnerships that we have. Next slide. First, we have Carolina Complete Health, which is Trillium's standard plan partner. They're responsible for our physical health network, including primary care, specialty care, durable medical equipment, vision, long-term services and supports, non-emergency medical transportation, and non-emergency ambulance transportation. We also have Centene Vision Services, Trillium's vision partner, which is formally involved. Through our agreement with CCH, they're responsible for our optometry network. We then have Perform RX, which is Trillium's pharmacy benefit manager partner, which is responsible for our pharmacy network. Motive Care, which is Trillium NEMT partner, and through our agreement with CCH, responsible for our NEMT network. And then lastly, we have North Carolina Department of Health and Human Services, which is Trillium's oversight entity, responsible for managing the delivery of health and human-related services for all of North Carolinians. Now I'm going to turn it over to Archie Hart to talk about disaster preparedness.
Hello, my name is Audrey Hart. I am the head of Regional Behavioral Health, Community Crisis and Disaster Response for Trillium Health Resources. And today we're going to be talking about disaster preparedness and how to get it started. If you do not already have an emergency plan or team that helps review that emergency plan, I definitely recommend creating a team. Reason being, no one person can do emergency response or preparedness for an entire organization on their own. So different suggestions is to include your leadership, facilities who may maintain the buildings, generators, and things like that. As far as whoever orders the food, water, and medication should be a part of this team, just because they will be the ones who prepare really the contracts and ensure that there is enough food and water if an emergency occurs. And then if there are other contracts that you all see, whether it's IT, whether it is for food and water and things like that, make sure that they are a part of the team. Whoever coordinates the staff for emergency staffing, making sure that the training is in place so that staff expectations are there, but also that you are considering if staff are expected to stay on site, if you are a residential or 24-hour entity, then ensuring that you are considering everything that a staff needs, whether it's can they bring their family or what kind of things do they have, is it a 24-hour shift, things like that. Documentation and patient tracking is a big piece of emergency planning, just to make sure that you are able to have business continuity if there are different types of emergencies that occur or impact your facility. And then all meetings and the team should be solution focused. In the same breath, the solution should not be person dependent. There are a lot of individuals who have been with organizations for a very long time and are the subject matter experts for what has happened in the past and things like that. And sometimes emergency plans tend to live in somebody's brain. This team is really there to help create and make sure that business continuity is on paper and more reliant on the roles itself and not necessarily a person. Next slide. Reviewing your current plan. Hopefully you do have an emergency plan, even if it's just a skeleton of one. Definitely recommend no less than a yearly review. Some individuals or groups will review it at the beginning of the year and then at the beginning of hurricane season in June. And typically when you bring your team together, the main things that you're reviewing is making sure that your leadership's intents and objectives are really being met. And then making sure that your operations or staff, any kind of changes are noted in your plan. And then I always recommend to have a change tracking page. Reason being, it really helps to make sure that staff or leadership that may be looking at this plan over and over every year know which pages and which sections have changed in the past. The likelihood of somebody going directly to that section and seeing the changes is greater than if you just say, here is the updated one, and not identifying where the changes have been. So just more likely to review it on a regular basis. And then when you do bring your staff together and you're reviewing your plan, make sure that you talk about lessons learned and the cycle that is the image on the side kind of reviews the whole process of emergency planning. Next slide. The biggest part of emergency planning is to know your hazards and doing a risk assessment. Knowing what could impact your facility so that your plan can try to address some of these risks. So knowing the natural hazards that may impact you. Thunderstorms are pretty common in our area, but if you are near a heavily wooded area, knowing that fires and wildfires may impact you, tornadoes, hurricanes, flash flooding, depending on where you are in North Carolina, we've had a few earthquakes in the past years. So knowing the different natural ones, this is not a comprehensive list, this is just a snapshot, but knowing the different natural hazards that may impact you, as long as along with cyber and technological hazards, which could be power outages, hazardous material spills, especially if you are close to commercial buildings or railroads and things like that. Depending on where you are in North Carolina, there are different nuclear power plants. If you are in Brunswick, there's the Brunswick Nuclear Power Plant, and there's one in the Raleigh area, and there's one in the Charlotte area as well. So knowing if you are close to those and what that looks like. The difference between cyber and technological and man-made, and the reason why cyber attack is actually under man-made is that it is intentional. Cyber and technological refers to accidents and not intention. So making sure that you are planning for things that may be intentional harm, things like cyber attacks, getting hacked, and things like that. And then also having a hostile intruder within your facility. Next slide. Some of the highlights, if you are a licensed facility, this is based on the requirements for CMS facilities, licensed facilities. I already mentioned the risk assessment, but making sure that you do have a staffing plan and that your staff are aware of what that staffing plan is. Missing residents is a big piece. If you provide services to individuals who have a tendency to wander, having a good plan and knowing that your staff are prepared if somebody does go missing, or if you all are on a field trip or whatever it may be, and you can't find your person, knowing what the steps are. Power loss, and then based on the power loss, when you should evacuate and when you should stay in place. Evacuation is not just for if there is flooding and water and hurricanes. It can be because it is getting too hot. We've had a very hot summer. We've had a very wet summer. Making sure that these evacuation protocols are in place. And to go along with that, if you do have to evacuate, where are you going? Or if there's a facility near you that may need to evacuate, are you able to support them? To go along with that, making sure that you do have a health sharing plan and resident identification plan to make sure that the correct plan goes with the correct individual, and then making sure that you are planning on how to get people there and get people out of harm. Communication plans is very important. When our cell phones and internet do not work, how are you going to continue communicating, whether it's with your emergency managers, with the 911 center, or with the families? Then making sure that you do have different programs and backup systems in place. If you're interested in getting more information, it gets pretty convoluted as far as having that plan in place. But if you need more information for any of this, please feel free to reach out. Again, just reviewing your policies and contracts for things that covers supplies such as food, water, and medicine. CMS does not require a certain amount of days for you to have on hand, although it is definitely suggested to have no less than a week's worth of food and water on hand should something occur. Next slide. Practicing your plan. We are pretty used to doing fire drills, maybe tornado drills, and maybe earthquake drills. Things that we don't always practice is if the power goes down or if your systems get hacked. There's a cyber attack, so making sure that you are able to continue operations, even if you can't document, you can't access charts, you can't access these things. Having a discussion-based exercise or a tabletop exercise really helps identify those gaps and points of improvement in a low stress, no fault environment. And then the goal is always to go from a tabletop exercise to a functional exercise, which practices certain parts of a plan. And then full scale is when you're practicing for the full facility should everything go wrong. Next slide. Emergency managers are often the group and entity that collaborates with all of the groups in times of large disasters. They work year-round to make sure that you are prepared, that schools are prepared, that different disasters have plans, and we bring all of the partners together. So making sure that you are connecting with them so that they know who you are and that you know who they are should you need assistance and should you run into something where you need to reach out to them, whether it's assistance with transportation, whether in times of an emergency, or to receive notification of something occurring in the community. They often host tabletop exercises and trainings that you may be able to join, and they are usually the local emergency preparedness committee leaders for your areas. These are committees that each county does have. They just meet on different variables. So sometimes it's once a year, sometimes it's every quarter, sometimes it's every month. So definitely take a look. If you don't know who your emergency manager is for your county, I definitely recommend reaching out to them and connecting. And then another avenue is the healthcare coalitions, which is the map that you see here. And they are a great resource to have as a partner, and they oversee the Office of Emergency Medical Systems, but they also help with the healthcare providers as well, and they have a lot of trainings that they provide. Next slide. Smaller incidents are still considered an emergency, so I would be remiss to not talk about when to call 911 or what to expect. Having somebody calling 911, they will continue asking you many questions, but on the other end of that phone, they are already dispatching first responders. So even if they are asking you many questions and you are in a high stress environment, ensure that you are answering their questions. The more information that the first responders have ahead to responding to an emergency, the better prepared the first responders that come to the door will be. So they know exactly what is needed to come in. They know which door to go to and things like that. First responders may not know your floor plan, so making sure that you do have somebody there to greet them, to bring them immediately to where they need to go so that they're not guessing, is very helpful. And then ahead of an emergency, try to contact your 911 center using the non-emergency phone number and share your emergency contact information. If you're not a 24-hour system or entity, then making sure that your emergency contact information is there in case your fire alarms go off or there's a burglary or anything like that. They know who to contact for your facility. And then sharing your floor plan is very helpful so that they have it in time if it is needed. Next slide. Currently, we are looking and monitoring Tropical Storm Erin, expected to become Hurricane Erin. I wanted to include this in here. It's still very early in the forecast to know the immediate impacts or non-immediate impacts for our area. I wanted to include the satellite to show you all the front that's coming off of North Carolina, which is what we are hoping is going to keep Erin out into the ocean. But again, it is too early to know the impacts or if there will be any. This is as of this morning. And one thing that I want to make sure that I do address is the fact that this cone of the storm that we can see on it is my right, hopefully you guys can see, in the key messages for tropical storm, the top image, you see the cone of impact. This is actually the cone of uncertainty and not the cone of impact. What I mean by that is the black circles along the where you see the hours, it shows where the eye of the storm could be. It could be anywhere in between this white shaded area. And that is not showing the width or how many miles across, sometimes hundreds of miles across, that the storm is. So even if you are outside of the cone, you may still see impact to your area. I know despite this image, the National Weather Service is working really hard to try to share that information, and that even if you are outside of the cone, which the image below shows you a little bit better how wide Erin is expected to become, you may see impacts despite being outside of the cone. So keep that in mind. Your impacts may still have tropical storm force winds, even if you are not in the immediate area. But keep an eye out. It is coming close to the peak of hurricane season. So it is definitely a good time to start reviewing your plans, talking with your staff and your residents or your members, and making sure that everybody is on the same page as far as emergency preparedness and what the expectations are. And that is all that I have, I believe. Yep. Thank you so much.
Good morning, everyone. My name is Markeisha Jackson, Network Development Coordinator for Trillium Health Resources. Today, I will be discussing the RFI, RFP, and Level 3 residential. But before getting into that, I wanted to let you all know our current service needs. They are listed on our website under the section for providers, and I will go through that step once we get to the RFI, RFP. Currently, we have the adult partial hospitalization. We have all the counties listed that the services are needed. Child and adolescent partial hospitalization, those counties are listed. Opioid treatment program, psychosocial rehabilitation, and SACOT, substance abuse comprehensive outpatient treatment. Next slide. The first topic we're going to discuss is the RFI and the RFP. The RFP is the request for proposals. It's a method of receiving detailed and comparable proposals from different providers or suppliers for a defined product or service. It's a comprehensive document that should provide all the required information needed to make an informed decision. Our RFI is our request for information. They are used to compile data and or information about current or potential providers, suppliers, vendors, and etc. Here I have listed the steps to finding these proposals on our website. You will log into trilliumhealthresources.org, and once you get on the website, the first step you will click on, and you can see it highlighted for providers. Once the drop down comes, you will go to network participation opportunities. Next slide. Once you select the network participation opportunities, your next step will be to go to the current service needs. Once you hit the arrow on the current service needs, the first thing you should see is the request opportunities. This is where we will list out any RFPs or RFIs that we have going on at the time. Next slide. The next topic I have is level 3 residential. The service definition for residential level 3 can be found in clinical coverage policy 8D2. This service has a highly structured and supervised environment in a program setting only, excluding room and board. This is a 24-hour service licensed under 122C. Trillium requires proof of licensure for contracting and the verification of licensure on the DHSR website and in NC Tracks. You can get your license for level 3 residential services at info.ncdhhs.gov and DHSR, and you'll go to the facility license info tab. And that's all I have.
Good morning, everyone. My name is Jacqueline Thomas, and I'm one of the supervisors in the claims department here at Trillium. And today I'm going to be talking about some of our top denial reasons on claims that we are currently seeing. And we're going to talk about these in detail and what you can do as a provider to research and resolve these claims issues. The first one is code 62, which is service not authorized. And to resolve this type of denial, you want to first and foremost check to make sure that you do have a current authorization for the member for the service. If you do find a discrepancy, you will need to reach out to our utilization management department, and their email address is here, um@trilliumnc.org. We also have some additional resources concerning authorizations that is available via our website, and we do have those links here for you. The prior authorization services tool is accessible from our website, and you can actually log into that, input your needed search criteria, search parameters, and it will let you know if that particular service does need an authorization. So that is a very helpful tool that we do have available to our providers. We also have a link here for our benefit plans and also the service definitions as well. The next denial code is number 330, which is patient not enrolled on the date of service. Please note that claims that fall outside of the member's eligibility effective dates will deny. So you can check Provider Direct or NC Tracks to check the eligibility for your members and clients. We do have the link for NC Tracks here. Also in Provider Direct, you can search your client's insurance, view information about their target pop. For example, if they are a client who receives state-funded services, so you can view their eligibility in Provider Direct. Any questions that you do have regarding enrollment and eligibility for a member, you can reach out to our enrollment and eligibility department, and their email address is here on this slide as well. You can also experience the 330 code denial if you happen to be billing a service code that is not included for the member's eligibility type. So an example of that would be if you are billing, let's say, a service, a state-funded service, however, the member has Medicaid only. Next slide, please. The next one is number 1018, claim received after billing period. And so in essence, this is when you file a claim that is after the billing days, and you will encounter this claim, or sometimes we call it a timely filing denial. So claims received after the required time frame will deny, and it is as specified in your actual contract. So if your contract states that you have 90 days to bill a service, your claim will deny on that 91st day. Most Medicaid services are on 365 days timely filing. If you do experience a denial for timely filing, and you would like to request a time limit override, that process is done via our website. You can fill out a claim request form to request a billing window, and that link is here for you. The instructions are also available on our website for completing the claims request form, and we also have some other helpful tools here for you as well. Our claims billing guide and also our prompt payment tip sheet is here as well. The next code, 1271, billing provider, NPI, and billing 9-digit zip. Billing provider, NPI, and billing 9-digit zip code combination not found in our system. So if you happen to encounter this denial, the steps you're going to take to resolve this are to first check NC Tracks. and make sure that the NPI and address match to what you submitted on the claim. If the address in your contract does not match what is in the NC Track system, you will need to reach out to our contracts department. After you receive confirmation that the contracts department has made your necessary updates, you will need to rebill that claim or claims. And again, we have the link for NC Tracks here for you as well. The next code, 1377, please submit to Carolina Complete Health for processing. The physical health claim has been submitted to the wrong processing system. We have a wonderful tool that will assist you in determining where you actually need to bill your claim, whether that would be to Trillium system or to the CCH system. And that it's the Tailored Plan and Medicaid Direct Claim Submission Protocol. That is accessible on our website. It is a wonderful tool for you to utilize in determining where to route your claims. Next slide, please. The next code is 1027, invalid service or service discontinued. You definitely want to review the service code you are billing and check to make sure that it is active in the benefit plan. There again, we have a link to the benefit plan below, the benefit plans and the service definitions. Information concerning covered procedure codes is also available on DHHS's online covered procedure code site for North Carolina Medicaid. We have also included that link for you below. The next code would be 1073. Client has other covered insurance or COB. As payer of last resort, members' primary insurance should be billed before Medicaid, and that primary insurance can be Medicare or any other private health insurance such as Blue Cross or Blue Shield. Check with the member to identify any and all third-party insurances that they may have. You will need to verify in Provider Direct if the primary insurance is correct or incorrect or possibly missing from our system. You are always welcome to submit a ticket to our claim support queue if you need assistance with updating a member's insurance, or for example if the insurance is indated or something to that effect. Once you have verified the member's third-party insurances, you will definitely want to bill the third-party insurance first, and then after that you can submit a claim to Trillium reflecting all of the appropriate COB information on the claim. We do have the link for NC Tracks here, as well as the link for Provider Direct as well. Next slide, please. A couple of other helpful tools. We have a known issues tracker that is available for you to view via our website, and we do have the instructions here for how to access that. It's under provider documents and forms. The known issues tracker, it's manned by our IT team as they identify claims processing issues or system glitches, things of that nature that have been identified. They publish that issue to the known issues tracker, as well as when they identify the issues, and the time frames that they are looking at in terms of getting those issues fixed. So that would be a very helpful tool for you to reference from time to time. There again, our claims submission protocol that I mentioned on one of the earlier slides, very, very helpful tool in terms of assisting you in determining where to route your claims, whether that would be to Trillium or to our physical health partner, CCH. Next slide, please. And lastly, if you have any questions about claims that you've submitted, claim denials, you can contact us at claimssupport@trilliumnc.org. When you send an email to claimssupport@trilliumnc.org, it's going to generate a ticket in our claim support queue, which will be routed to one of the members of our claims relations team, and they would definitely be happy to assist you with any issues that you have or any questions you have. And you are always more than welcome to contact the provider support service line at 855-250-1539. Next slide. And I will turn it over to Jamie Dew with eligibility and enrollment. Thanks, everyone.
Thank you, Jacqueline. Good morning. My name is Jamie Dew, and I'm the Eligibility and Enrollment Manager. I will be going over the eligibility and enrollment overview. Eligibility and enrollment processes new enrollments, clinical updates, and assists with questions and concerns regarding member eligibility. Next slide, please. In Provider Direct, to look up a member or recipient, click on the Client tab. Minimum search requirements are Social Security number alone, last name and client ID, Medicaid number and last name, first name, and date of birth combined. Please be sure to exhaust all minimum search requirements when searching for the member or recipient. Next slide, please. If you search by the date of birth, the member recipient will not display since this is not within the minimum search requirements. And you will see the message above display, giving you the minimum search requirements. Next slide, please. If you search by the Social Security number alone, the member or recipient will display as shown below if they are already in the system. If no results are found and you have searched by all other minimum requirements, the member or recipient is not in the system. To view the member or recipient client homepage, you would click on Select. Next slide, please. Once you click on Select, the client homepage will appear and land on the Insurance tab. This will show you all insurance plans the member recipient is enrolled in, as well as third-party insurance plans. Next slide, please. To view state benefit plans, formerly known as Target POPs, click on the Target POPs tab, and this will show you the Target POP groups. These are for state-funded recipients only. Next slide, please. To submit a client update, click on the Client Updates tab and then click on the Add Client Update and the form will appear. Next slide, please. To submit an enrollment to request state funds, on the top banner, click on Enrollments and then New Enrollment. Next slide, please. Next, you will search for the recipient. If the recipient is already in the system and displays below, from there, you will click on the New Enrollment hyperlink. If no results are found, you will create a new enrollment. Next slide, please. Provider Direct Trainings. In Provider Direct, click on the Training tab. Under Training Materials, you will find the Client Update and Enrollment Trainings. Click on the select hyperlink to view the training. Next slide, please. Eligibility questions can be submitted to Enrollment and Eligibility at trilliumnc.org. This concludes the eligibility and enrollment overview, and now I will turn it over to Gaines Carey, Education and Training Coordinator. Thank you.
Thank you, Jamie. As Jamie said, I am the Education and Training Coordinator for Carolina Complete Health. You can go to the next slide, please. And today I'm just going to be presenting on just some physical health reminders if you're a physical health provider. Next slide. Just as Jamie had, Jacqueline had iterated earlier, if you get a code saying that you are to submit to Carolina Complete Health for physical health, this is how you would submit. So I'd highly encourage you to use our Trillium Physical Health portal. In this portal, the key functions are listed here, but you can check eligibility. You can submit and check the status of prior authorizations, claims submissions, claims disputes, any payment history, and health records, and much more. So I encourage you to utilize this portal. If you have not created an account, here is the link to do so. When you create an account, you will need your tax identification number, a phone number and fax number, as well as a working email. Again, if you have some issues getting this started, or if you just need help troubleshooting how to actually work the portal and navigate the portal, we have some link to a slide deck here that can give you some additional information with screenshots, as well as we have a provider engagement team that is there to support you. Happy to set up a meeting with you. Again, if you want to know who your provider engagement administrator is, you can click on the link here or email this, and someone will email you within 24 hours. Next slide. Additionally, if you work with a third-party biller, just to let you know that they can also have access to this portal. The only stipulation would be that the portal account manager would need to grant them access. So by doing that, they would have to go into the account and select invite a user. That would then generate an email to the biller. And at that point, the biller would fill in that information, again, that tax identification number, phone and fax, and request to be verified. At that point, the account manager of the organization would then verify them. Next slide. And I just wanted to go over some top claim denial trends for the physical health. It's kind of very similar to what Jacqueline presented earlier, but just on the physical health side. This top claim denial right now is on our known issues tracker. That is updated weekly, typically on Thursday or Friday. But if you are seeing the denial for primary EOB auth required for EP-SDT consideration, that is a known issue that we are seeing on our end, and that expected fix is going to be August 22nd. Again, the guidance that we are giving providers is that you don't need to do anything. It will be reprocessed once that system is in fix. The next couple of denials are related to taxonomy and the billing NPI not being correct. Again, we just want to encourage you to make sure all information is correct on NC Tracks. That is considered our source of truth. So if you have a new provider, please make sure that credentialing is current. And lastly, we have our top other denial is revenue codes. We have a link here to those revenue codes just to make sure that they're on the claim as it should be. Again, this is just a graph that can kind of give you provider guidance or what to do if you see any of these claim denials. Next slide, please. Also, we just want to let you know that if you are a PCS provider, we do offer additional trainings. The links are here for recordings, and we have a Q&A PDF that you can utilize. We also have a physical health provider orientation that we host monthly. You're welcome to attend that, as well as just some new provider onboarding checklist. Also worth mentioning, the hard launch, the EBV hard launch for home health is going to be implemented on October 1st. So we do have office hours that partner with Trillium, ourselves, and HHA Exchange. So please feel free to attend that if you're a home health provider and you want additional support. Next slide. And again, this is just some link to additional resources, primarily our provider and billing manual. That's a great tool to have should you have any questions. But please keep in mind that with every organization, you do have a provider engagement administrator and a provider relations coordinator assigned to yourself. So please feel free to reach out should you have any questions. Next slide. And that is it for me. And I'm going to hand it over to Meg Sanders, who will be presenting with NC Tracks.
Good morning, everyone. This is Dr. Meg Sanders, the Provider Data Management Manager of this unit. Next slide, please. I would like to talk about NC Tracks and provider updates, and that is because NC Tracks is a multi-program NC Medicaid Management Information System that is really used to house provider information by the state to simplify claims. So ensuring provider information, your information, is up to date and accurate, NC Tracks is very critical to prevent claims denials and simplify the processing of claims at the state level. Next slide, please. So to prevent any disruption in payment or claim denials, if you experience your agency or as an LIP, if you as a provider experience any changes in your provider information, or if there's any updates, please submit them to NC Tracks in a promptly and timely manner. And this can be done by submitting a managed change request under the provider's profile. Next, please. And you can see here that for the provider's profile, NC Tracks does give you, it shows you where to go under status and management. And then under status and management, there is that managed change request portal to be able to update your information. Next slide, please. Any outdated information in NC Tracks can lead to suspensions and terminations, and that's why updating information is so important. So some common reasons why information is suspended or terminated at the NC Tracks level, which could lead to claims denials, is due to things like expired credentials or licensure in NC Tracks, a lack of re-verification or re-credentialing, invalid EFT or electronic funds transfer information on file, or no individual provider organization affiliation, or no claims activity for 12 consecutive months. Next slide, please. So to report to NC Tracks if there are any changes, things such as a change or an added site or service location, any renewal of credentialing or licensure before that expiration date, removal or adding to provider organizational affiliations, any voluntary terminations such as a taxonomy code or site location or service location or service. And then critically, a lot of times we see that a point of contact or an email address needs to be updated, and that sometimes can impact the provider in NC Tracks. And then lastly, maintenance of the provider profile in NC Tracks should be done at least once a year just to maintain that information. Next slide, please. And then finally, NC Tracks website provides a variety of resources to providers, which does include frequently asked questions. So if you ever do have questions, that is a great resource to see if it's been answered. Provider announcements that are sent out oftentimes weekly, There is a provider policy, manuals, guidelines, and forms tab. And then there's also provider user guides, fact sheets, and training. Next slide, please. So final thoughts to ensure that your information is updated and maintained and is not suspended or terminated in NC Tracks due to some information being outdated, which can cause claim denials and impact services. Just make sure that information in NC Tracks is up to date and accurate. And if you do need to submit any change or submit an update, going through that managed change request portal will be very important. And then try to review that information in NC Tracks at least once a year. Next slide, please. Now we'll turn it over to Chauncey Dameron for the provider forum schedule. Thank you.
I'm just going to review some updates for our upcoming meeting, provider forum meetings. The next scheduled meeting is for September 10th, 2025 and October 8th, 2025, both at 10 a.m. Due to the holidays, we will not have any provider forums in November or December. So in September and October, we're going to try to capture as much information as we can, and then we'll reconvene to start the year off in January. Next slide. I'm going to go over a few resources, and then we'll do our Q&A. On our Trillium website, if you click on the For Provider heading, you will see their provider information column, and that is where you will be able to find the provider forum Q&A. If we have any frequently asked questions that have been in the chat, and we have the actual recording of the provider forum presentation, and then we have the slides as well that were presented in the provider forum. And we have these listed for each month. We did have some delay in a couple of previous months getting some information added, but we should be able to have this presentation added by next week on our provider webpage for you to be able to view and download. Next slide. And so lastly, we'd like to thank everyone for your participation to attend the provider forum. These are our links and websites and resources that will be available to connect with us. And we now will start our Q&A presentation to see if we have any questions in the chat. If you have any questions that you want to come off of mute, please also raise your hand and Jamie will take you off of mute if you cannot, and we will get those questions answered by subject matter experts. All right, I do see a question from Sharice Jones. She says, may I get a link for the PCS provider meetings? James, can you send her the link to that in the Q&A so she can get that?
Yes, I will. Give me 1 second.
All right.
Happy to do that.
Jamie, do you see any hands up?
As of right now, no.
Okay. Again, if anyone has any questions and they want to come off of mute, just raise your hand and Jamie will get those questions. We'll get you off of mute so we can get the question answered.
Still don't see any, Chauncey.
Okay, great. All right, James has gotten the information to Sharice. If we don't see any more hands, we'll give it 1 more minute, and if not, we'll conclude today's provider forum, and we thank you for attending, and we will get this information posted on our website for you. All right, have a great day, everyone.